I've washed my hands and entered my patient's room. Hi, my name is Becky. I'm going to be your nurse today.
Hi, Becky.
Could I take a look at your armband?
You sure can.
Can you tell me your name and date of birth?
Yes, it's Kathy Donovan, 2/28/73.
Thank you.
You're welcome.
And do you have any allergies?
Erythromycin, penicillin, and aspirin.
I have that noted, and we don't have any of that for you today.
Great.
This is my third and final check of my medications. The first was when I came on shift and I verified I had all the medications for the day. The second is when I'm preparing my medications. And the third and final check is here at the bedside. Let me review with you what I've got for you. I've got your morning medications, okay? What I've got for you is your digoxin. It's 0.125 milligrams. And I'm going to need to listen to your apical heart rate first.
Sure.
Okay? And then I'm going to need to give you half a tablet, so I'll split that.
Okay,
All
sure.
right? I also have your diazide. It's 37.5, 25 milligrams.
Yes.
I've also got your potassium, 60 milliequivalents. They're 20 milliequivalents each, and I've got 3 of those for you.
Okay.
I've got your Lasix, 20 milligrams. And your Hydro, 50 milligrams.
Yes, I'm used to taking those.
Good. I've got your insulin. It's Novolog insulin. Your blood sugar this morning was 222.
Okay.
And I have 6 units of Novolog for you. Go ahead and listen to your apical heart rate for a full minute. You would listen under clothing, and you have to listen for a full minute. Her heart rate is 97, so it's perfectly acceptable for her to get this medication. I'll split that in my pill splitter. And I'll go ahead and open these medications. I see you're sitting up. That's important. I don't want you to choke. Now, how do you like to take your medications? Do you like to take them one at a time or all at once?
All at once is fine.
All right, here you go.
Thank you. Thank you.
You're welcome.
Oh, one more?
Yeah, that's your digoxin.
Thank you.
Mm-hmm. Thank you.
You're welcome. Okay.
Now we're going to move on to the insulin injection. Before I give you your insulin, insulin's going to drop your blood sugar fairly quickly. This is a fast-acting insulin. I want to ensure that you're going to be eating breakfast. Are you hungry for breakfast?
I am very hungry.
Good. I know the breakfast trays are coming up in a few minutes, and I just want to make sure that she's going to eat so that her blood sugar doesn't drop too rapidly. Let's review some of the sites that you can give your insulin. You can give it on the back of the arm. You can give it on the abdomen, 1 to 2 inches away from the umbilicus. You can give it back on the muffin top or flank, love handle. You can also give it on the top of the thigh. Make sure you're staying away from the femoral artery though. Always ask your patient if they have a preference where they like to get their insulin. Do you have a preference where you'd like to get your insulin today?
Yes, I do prefer my abdomen.
Okay. Which side did you have it last? Do you remember?
I think it was my left.
Okay. It's important to ask that because we need to rotate the sites to prevent tissue injury. So she said it was her left. We're going to give it on the right side. First, I need to clean the site and let it dry. I'm going to remove my cap and put it in the trash. The angles that you can give a subcutaneous injection are, if you can pinch 1 inch, you would go at a 45-degree angle. You would this direction as opposed to this direction because you could stab your finger. If you can grab 2 inches of tissue, you're going to go at a 90-degree angle. And that's the preferred because you decrease the risk of sticking yourself. Notice that I've only uncovered the amount that I need for this injection. I've also provided privacy. Pinch 2 inches. I'm holding the syringe near the top to make it easier for my finger to reach the plunger once I've put the needle in. A quick dart, I inject, and let go and remove the needle at the same time. Again, I'm going to lock my safety on a hard surface away from my patient. This is going to go in the sharps container. I'm going to remove gloves. And I'm going to sign off my medications. I'm going to sign off directly under the time with my initials. Mrs. Donovan, let me know if I can do anything for you.
Thank you.
Here's your call bell.
Thank you.
Finally, I'll wash my hands.